Dr. Bradshaw here with Chirocynergy. Today we're talking about COVID-19. Yes, it is the word of the year. It is the topic of the year, of course. We want to talk about today about proper hygiene, what to do, what not to do when dealing with COVID-19. As a doctor, I clearly have certain standards that I have to follow, not only set by the CDC guidelines, but also by my state board. You may not have those similar guidelines, but I will say this. As a fellow human being living in the same airspace that I do, I would like other people to follow similar guidelines to what I do in terms of just basic hygiene. We're going to talk about that today. So of course, that starts with the use of masks. Now obviously if you're outside, the research shows you're very less likely to get the virus outside unless you're in a real concentrated group of people, like a concert or a sporting event. And since none of those things are happening right now, you're probably pretty safe outside. But if you were indoors, wear the mask, all right? So here is a mask. Most people I see wearing these days, some people use the cloth masks. These are pretty safe and sanitary in terms of how to put them on. You want to avoid, the CDC shows, putting your hands on or around your face, okay? So when you're putting these on, you want to make sure you grab it on the elastic edges, okay, like this. Bring the nose underneath, pull tight behind you, so that the only thing that your hands touch are the backs of your ears when you put this on, okay? You can see my chin is covered, my nose is covered, and my hands haven't touched my face, okay? As well, taking it off, same thing, touches behind the ear, pull out, you take it off. Your hands never have to touch your face, just behind the ears when you're using the paper mask, excuse me. The cloth mask, similarly, should be able to pull that tight right up underneath the nose, this, down and back, okay? Now, the cloth mask doesn't cover the chin as well. So sometimes you have to actually take your hand and pull it down a little bit, okay? That's not as safe, which is why these masks aren't as great as these masks. But regardless, your job is to try and not touch your face, okay? So when you have the mask on, make sure during the day that you're not touching your face. And I think that many of us, since this started a few months ago, realize that just doing that, touching your hair, is something we do all day long, right? Apparently we touch our face much more than we thought we did, right? It's crazy. So you want to make sure that you just don't touch your face during the day. And if you do, you wash your hands, okay? So let's talk about how to wash your hands properly so that way you can make sure you reduce the transmission of this virus as much as possible. All right, now when it comes to washing your hands, I would think that all of us learned this back when we were in grade school, kindergarten, preschool. But I see people at the airports, I see people in the grocery stores, they're not washing their hands properly, all right? As a doctor, of course, we were retrained on how to properly wash our hands so we don't transmit germs to people. This has come in very handy for dealing with COVID, all right? So let's talk about washing your hands, okay? You wanna make sure that everything from the mid-forearm to the tips of your fingertips gets wet, okay? So you gotta get the arms underneath there. Make sure everything gets wet, right? Once you're there, soap. We want to make sure we wash our hands. We want to get in between the fingers, okay? As well as the backs of the hands, not just the palms, but also the backs of the hands, okay? And once we get that done, we want to make sure we get up the forearms too on both sides. You have two sides to your arm, right? You need to get both sides. All right, now everything is clean. We're going to rinse off, okay? Whole hand, spread the fingers, get the water in between there, get everything in between the fingers, all right? That's important. Same thing with the other arm. Fingers spread apart, get the water in between there. Good. I recommend you leave the water running. The faucet and touching those handles can be dirty. You can transmit disease, you can transmit germs, you can transmit COVID, all right? So you're gonna grab your paper towel. You're gonna dry your hands out. Yes, you're wasting a little bit of water, but you're not transmitting COVID, okay? Clean off the arm, hands, everything dried off. Take that paper towel. Use the paper towel to close off the faucet. Done. The other thing I recommend is when you are leaving, you take another paper towel, tear it off, and use it to grab the handle of the door as you're exiting the bathroom. Okay, so you grab the handle, you don't have to touch it with your hand, you touch it with this, and then you just throw that away as you're walking out. All right? That is the best way to wash your hands. I recommend that you wash your hands every time you touch your face. You're like, I touched my face, I gotta go wash my hands. Eventually you'll stop doing it because washing your hands all day can be a pain in the butt. But ultimately, if you're inside, if you're touching things, this is how you should do it. This is the safest way, safest practices for everybody around you to make sure that we're not transmitting COVID via dirty hands. All right, have a great day.